Hello, my name is Ann Gaddis. I'm the Director of Public Policy with the Maryland Coalition of Families. Like most of our staff at the Coalition, I'm the parent of a child who experienced significant mental health issues, and so I bring lived experience to discussions about practices and policies regarding children's mental health. Family engagement is a key component of student mental health. Just as a student's academic success can be linked to family engagement in their child's school and education, so too is a student's mental health strengthened when families are engaged in their child's social and emotional development. Many studies have shown that a family's engagement in mental health supports produce better outcomes in children, both for those who are experiencing mental health struggles and those who are not. Therefore, to best support the mental health of students in schools, families must be engaged in the process. Families oftentimes need information about social emotional development in children and youth and strategies to promote good mental health. Schools can be a conduit to pass on relevant information to families. This can be done in materials sent home or in webinars and presentations offered to families. Since there is abundant evidence that more students than ever are struggling with mental health issues owing to the pandemic, many parents who previously may not have been interested will be eager to learn more about promoting positive mental health and what to do if they think their child has mental health needs. As always, the more that the ideas and preferences of families are solicited, the more likely any health initiative has of being successful. Sometimes families do not recognize the mental health problems that may be developing in their child. This was the case with my family. It was only when the school reached out to us and suggested that my son appeared to be experiencing troubling symptoms and recommended that we consult with our pediatrician that we became aware of the extent of the problem. In turn, it was our pediatrician who recommended that we seek a mental health consultation. Our son's school played a key role in our ability to help our child. It's not only students, but also caregivers whose mental health may have been negatively impacted by COVID. Any attempts to engage families in promoting good mental health in a child must recognize that the caregivers too may be struggling. Therefore, school activities that have been designed to promote good mental health should be mindful of the needs of both families and children. In addition, an important strategy to promote the engagement of families is to offer activities and services virtually. Webinars, as opposed to in-person presentations, allow more families to participate. Activities that can be done virtually will hold greater appeal to many families. It is imperative that families continue to be given the option of participating in the delivery of any school-based mental health treatment via telehealth. We know that the mental health treatment outcomes of children improve greatly when their families are engaged, but often it is a tremendous burden for a caregiver to meet in person with a school mental health provider or to participate in their child's treatment in person. Telehealth allows for much improved family involvement. Finally, families should participate in all levels of planning regarding what mental health services and supports are needed within the school. For example, recently in Maryland, the state superintendent led an initiative to develop regional mental health crisis teams across schools in the wake of the COVID-19 pandemic. Families were asked to participate in the planning meetings and to present on their family's experience with mental health crisis services. The more family perspectives that can be brought to inform planning, the better. Focus groups, surveys, and school forums all can serve to solicit the ideas of families. School mental health services and supports will be more successful with buy-in from families, and the best way to achieve buy-in, and therefore family engagement, is to solicit people's opinions and design services and supports in alignment with what families want. The success of various programs should be regularly evaluated with input from families and adjusted accordingly. Thank you for listening. I hope that you found these suggestions helpful in prioritizing the support of mental health in your schools.